How to treat a bee sting. Spending time in your garden or hanging out with friends at a park is a wonderful way to spend the afternoon, until you feel a sharp poke and realize you've been stung by a bee. Bee stings are relatively common and don't have to ruin your day, as long as you act quickly. A bee sting is a painful injury that happens after a bee pierces your skin and injects venom. You can treat minor bee stings at home. Sometimes, your body can react negatively to a bee sting, and it causes a severe allergic reaction that requires immediate medical attention. Here, we've gathered some of the best options so if you'll know what to do if you get stung. Welcome to The Guardian's Choice. Follow all the steps in this video for the best results, and don't forget to subscribe to get all the household tips and tricks you don't want to miss. How to treat a bee sting. Number 1. Remove the stinger immediately. Use your fingers or the edge of a credit card to flick the stinger out. Flick the stinger sideways to ensure it doesn't break off in your skin. The stinger still has venom inside it. Removing it as quickly as possible limits the amount of venom that enters your bloodstream. The less venom in your bloodstream, the milder your reaction will be. Take care not to squeeze the stinger, which could release more venom and defeat the purpose of removing the stinger. If you don't see a stinger, all that means is that you were likely stung by a yellow jacket, a hornet, or a wasp rather than a honeybee. Only honeybees lose their stingers, the others remain intact. Number 2. Wash the area with soap and cold water. Washing the area cleans off any residual venom and bacteria. Any dirt or bacteria present around the sting could lead to infection, so it's important to make sure the area is clean before you attempt to treat it further. Cool water can also help ease the pain and inflammation from the sting. If you're worried about a possible allergic reaction, mark the swollen area carefully with a pen after washing it so you can keep track of any spread. Number 3. Take an antihistamine as soon as possible. Oral antihistamines, such as Benadryl, relieve your whole system. Even if you've never had a severe allergic reaction to a bee sting, an oral antihistamine can help. By reducing your body's allergic reaction, you'll have less pain and itching to manage. An oral antihistamine can also blunt what might have been a more serious reaction, but only if you take it as soon as possible after being stung. Number 4. Elevate the affected area. Elevating the affected area above the heart can reduce swelling. Depending on the location of the sting, the amount of swelling might seem alarming. However, it's usually no cause for concern and will typically go away within a few hours. For example, if you get stung on your hand may swell to twice its normal size. While it might look bad, it's typically no cause for concern. Elevating your hand will help the swelling go down faster. Number 5. Use a cold pack to reduce swelling. Wrap an ice pack in a towel and place it directly on the sting. You can also use a bag of frozen vegetables. Just make sure you're not putting anything frozen directly on your skin. Leave the ice pack on for 10 to 15 minutes, then take it off. You can repeat this every couple of hours as needed if it gives you some relief. If the swelling moves to other parts of your body, especially your face or neck, it could be a sign of an allergic reaction. Call emergency services or get yourself to an emergency room or urgent care clinic as quickly as possible. Follow all the steps in this video for the best results, and don't forget to subscribe to get all the household tips and tricks you don't want to miss. Number 6. Try home remedies for additional relief. Basic items typically found in your pantry can help relieve pain and itching. If you're more of a do-it-yourselfer, these home remedies might become your go-to in the event of a bee sting. Feel free to try any of the following and see if they help. Mix baking soda and water to form a paste. Cover the affected area and let it sit for 15 to 20 minutes, then rinse it off. Mix unseasoned meat tenderizer and water to form a paste. Just like the baking soda paste, leave it on the sting for 15 to 20 minutes, then rinse it off. Soak a tea bag, then rest it against the bee sting. Leave it there for 15 to 20 minutes, then wash the area with soap and warm water. Number 7. Take an over-the-counter pain medicine for pain. Try acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, to relieve pain. Bee stings can be painful, but these basic OTC pain relievers can help. Follow the dosage instructions on the bottle. Don't take any more than that unless your doctor told you to. You shouldn't need anything stronger for pain. If you think you do, go to an urgent care clinic and have a doctor assess your situation first. Number 8. Use hydrocortisone cream to relieve itching. Hydrocortisone and antihistamine creams numb the skin and calm itching. Scratching a bee sting can make it worse by spreading the venom and potentially leading to infection. If you can resist the urge to scratch, applying a cool layer of Benadryl cream or calamine lotion will help. Most of these creams combine an antihistamine with a topical steroid to reduce the symptoms at the source. You can also cover the area with a light bandage to keep it clean and reduce your urge to scratch at it. Number 9. Watch for signs of an allergic reaction. An allergic reaction can be life-threatening unless treated promptly. It's possible to become allergic to bee stings even if you've never had a reaction in the past, so always keep an eye out for symptoms when you get stung. Be on guard for dizziness or tingling sensations, hives or itching beyond the specific location of the sting, swollen lips or tongue, difficulty breathing. Number 10. Call emergency services if you're allergic. If you have an allergic reaction, every second counts. Because anaphylaxis can inhibit your breathing, an emergency medical team may need to perform CPR. They can also inject antihistamines and cortisone that will reduce inflammation and ease your body's allergic response. Once you have an allergic reaction, your doctor will likely prescribe an emergency epinephrine auto-injector, such as EpiPen. Make sure you keep this on you at all times, especially if you're going to be spending time outdoors. How to prevent bee stings. 1. Being aware of your surroundings. If you're outdoors and near flowers or areas where bees are active, be careful not to disturb them. 2. Removing food. Bees are attracted to foods that you might have at a picnic or outdoor event. Try to cover foods and clean up any dirty dishes to keep bees away. 3. Not using floral-scented products. Bees like floral or fruity scents. If you use hair or skincare products that smell like fresh flowers, bees may mistake you for one. 4. Wearing protective clothing. Choose clothing items that cover your skin, like long sleeves and pants, especially if you're working or playing outdoors. It's very easy to step on a bee, so wear closed-toed shoes instead of bare feet when walking in the grass. 5. Staying calm. Bees aren't aggressive insects and only sting to protect themselves. If you swat at bees or try to shoo them away, you put yourself more at risk of getting stung. If you stay calm and let the bee pass by, it'll go away without harming you. Tips. 1. Give bees and other insects plenty of space and stay away from flowers to avoid getting stung. If you see bee activity, move away from the area calmly. 2. Wear unscented lotions and cosmetics to avoid attracting bees that might mistake you for a flower. 3. If you have an epinephrine autoinjector prescribed for severe allergic reactions, always keep it on your person when going outdoors. Bee sting reactions can quickly become life-threatening, so having the EpiPen readily available could truly save your life if needed. Don't take the risk of leaving it behind. 4. In the days following a bee sting, keep watch over the area. Call your doctor promptly if you notice increasing redness, warmth, or pus, which could signal that infection is setting in. 5. If stung on the hand or foot, take off any rings or shoes right away before swelling starts. This prevents circulation issues or discomfort from the sting site becoming constricted. 6. After getting stung by a bee, immediately head inside and wash the area thoroughly with mild soap and water. This helps prevent a bacterial infection from developing in the wound. 7. Wrap an ice pack or folded cold, wet cloth in a towel and apply to the sting site to reduce pain and swelling. Never put bare ice directly on skin as it could damage tissue. Warnings. 1. Watch for signs that redness or swelling is spreading, which could indicate an infection. While infected bee stings are rare, if it does get infected you'll need a round of antibiotics to clear it up. Choose the method that works best for you and your situation, and help to avoid bee stings. Follow this channel to learn many more household tips, tricks, and life hacks like this. If you have other tips, please share them with us in the comments. Hope you enjoy. See you in the next video.